Hi, everyone. Welcome. We are so excited for you to join us for another phenomenal webinar. Today, we are going to talk about ageless beauty with a specific emphasis on how neurotoxins can be used to address wrinkles and really help in the anti-aging process. But before we get into all of that fun stuff, I do want to introduce you to our lovely host today, PA Alicia Haslauer. Hello, Alicia.
Hi, how are you?
So good, so good. I'm very excited to hear about how neurotoxins are going to be able to help me with my wrinkles. Spoiler alert, I've had them before, but I want more. So let me go ahead and start the presentation so we can start chatting about all this really exciting information here. So let's see, we said ageless beauty. And like I said, we have PA Alicia Haslauer with us here today, who is a phenomenal provider that we have at our Pool Dermatology location. And she has been working closely with Dr. Pool at that location for over 10 years now. She is a seasoned veteran. And let's see here. So what we're gonna do first is kind of chat about aging. So tell us a little bit about the aging face.
Okay, so this first picture here, it compares a daughter and a mother, and the daughter is 26 and the mother's 64. And you can just kind of study the face and see some of the changes that you can notice, some of the changes around the eye, around the cheek, some of the lines, some of the set in wrinkles that you might see with some time.
Definitely. And so tell us a little bit about how youthful features appear typically.
Sure. So you can see a smoother skin tone and texture. You're not going to see deep set in lines from years of muscle movements. Even skin color, nice high cheekbones and full cheeks. We don't have we have thick fat pads. We don't have loss of fat pads yet. Defined jawline, good bone structure overall in the younger face.
That inverted triangle. And then as we get older, tell us a little bit about what happens.
Yes. So then instead of the focus being up top on the youthful face, as we age, everything starts to sag down a little bit more, and that triangle does become inverted with time. So you might notice a little bit more set in lines just from years of repetitive muscle movement, sunspots, broken blood vessels, just from sun damage with time, drooping skin that loses elasticity, flattened cheeks because we've got a loss of fat pads, some sagging jaw lines, and just a fullness under the chin.
Definitely. So then you talked a little bit about this already, but briefly kind of explain muscles and aging for us.
Sure. So just with our daily facial expressions and repetitive muscle movement with time, when we're always contracting those muscles over time, the skin does get some deep set creases and lines just from that repetitive muscle movement. Some common areas are, you may have heard of the 11s. Those are going to be those vertical lines between the eyebrows. Some forehead lines, horizontal lines that go all the way across your forehead between your scalp line and your eyebrows. Some crow's feet just from smiling and all of our facial expressions that might radiate from each side of our eyes. Bunny lines are going to be those horizontal lines that you might get on the side of your nose just from different facial expressions we might make.
That's crazy. And then I know that you mentioned before about the fat pads, about how we kind of lose that volume, and it looks like here they're kind of drifting apart from each other.
Yes, this is a great diagram that can show you the daughter side of the face compared to the mother side. And you can see those fat pads, just the volume that we lose, and those kind of shrink, and we get fat loss with time. And so overall, we have that loss of fullness, a little bit of hollowing under the eyes as those fat pads shrink. The skin, again, not as elastic. We get some wrinkles, again, with that muscle movement. It's all kind of multifactorial, but with time, again, you'll notice the sagging jaw lines. People refer to that as jowls, and fullness under the chin.
Wow. Now that we kind of know what's going down, literally going down, we're going to talk about how we can fix this. Yes. Or assist in these areas and help with the anti-aging efforts. And I'm so excited to hear about this. So tell us how we can relax those wrinkles with neuromodulators.
So neuromodulators are natural purified protein products. You may have heard of Dysport or Botox. Those are the two neuromodulators that we carry, and we use these to place them right into the belly of the muscle, and that will inactivate that muscle so we can soften the movement, almost prevent it from being able to contract, and therefore will soften the appearance of those deep set lines on the skin with time. So those smile lines, frown lines, all the lines that we make from our, squinting, talking, all of our facial expressions, we can soften that with the neuromodulator use.
I love that. I love that. And then one question I have for you is I hear often, or you see in movies and whatnot, that people are concerned that they're going to look completely frozen and that they're not going to be able to move their mouth and all that sort of stuff. Is that something that you think is real, or explain that?
Not at all. Not at all. We're not going to make you look fake looking at all. We're literally just stopping that muscle from contracting and softening that line. We're not adding any volume with the neuromodulator. We're just softening the appearance.
I love it. Good to hear. So the scary tale is not true.
Right.
And then you told us a little bit, Botox and Dysport are two of the common treatment options. And is there a difference between the two products?
We look at them the exact same. We dose them the same. We love both of them.
Yeah, no, for sure. And I think that's a great thing to say. And one thing to segue into is consultation is key. The importance of meeting with your provider to decipher what direction you're going to go, because there's lots of ways to kind of get to the same endpoint. And so this is one of those cases where that makes most sense, that, there's two options here. By no means do you feel like you have to do all of your crazy research to figure out which one is best for you. That's why you go into someone like Alicia, who is a very seasoned and great injector, to have her kind of guide you in the right direction. And you can talk about what your concerns are, what you're specifically wanting to focus on, and then she can help you decide which one is best for you.
Yes.
So tell us, you kind of said this already, but give us a brief overview of some of those things. You said the eyebrows, the bunny lines, a little bit kind of starting more at the nose down. I see here gummy smile. Can you tell me a little bit about that?
Yes. So exactly. The ones that we mentioned so far are just kind of the common ones that people start to first notice when they first start to say, I wonder if this is a good product for me. They're usually initially noticing the vertical 11 lines between the eyebrows or the horizontal forehead lines. That's kind of the more common. Then with time, the crow's feet and the bunny lines might start to bother them. And then we have some specialized uses of the neuromodulators. If someone has a gummy smile, we can place the neuromodulator underneath the nose and relax that muscle and bring down the lip a little bit to cover some of that gummy smile. That's a little bit of a specialized placement. We can do it around the mouth to give you a fuller look of the lips if you're not yet ready for the filler, but we can actually relax those muscles. We can achieve that with neuromodulators. Some people might have a dimpling or a pitted chin, and so we can place the product there and give you a smoother texture there. Sometimes we can place it in the masseter muscles. That's going to be if you have sometimes TMJ, or you're clenching your jaw, or if you just have a really pronounced jawline. We can place the neuromodulator there and relax that masseter muscle, just smoothen the look of that jawline as well.
That's
And the platysmal bands. I think there's a slide coming up. We'll talk about that in a second, but we can actually smooth out some of the lines on the neck as well.
For sure. It's crazy how many different areas that you can treat and how much can be addressed with just a neuromodulator treatment, which is like extremely fast and pretty simple. So here's a great example of a neuromodulator treatment in like the typical treatment area. So give us a brief rundown of what we're seeing here.
Sure. So in that first top picture, you're seeing the patient actively trying to raise her eyebrows and creating that muscle contraction of the frontalis that's then creating those horizontal deep set lines. And so when that patient relaxes, you can see we're not making as deep of a line, but you can still see some of those lines etched in the skin. If you look in the middle picture, that's the patient relaxing, where you can see those lines still without the muscle movement, compared to the picture to the left where she is moving the muscle. But below it, that patient's been treated. So about, usually 1 to 2 weeks after treatment, that product's been able to settle in, and we can no longer contract when we try to raise the eyebrows up, and then the skin above it looks nice and smooth and lays flat. And then the picture all the way to the right, the patient's contracting, trying to bring her eyebrows together, creating those active 11 lines. And then after treatment, she can no longer make the muscle contraction. And she doesn't look frozen. She looks very natural. Everything's just softened and smooth. It's just not able to contract when she goes to talk or makes an angry face.
For sure. And I love how even just a simple treatment is able to kind of smooth out the forehead. And it looks monumentally different with such an easy treatment, which is very exciting. So tell us a little bit about what's going on here.
Yep. So same thing. It's a before picture of those corrugator muscles contracting, and we're making those 11 lines, and then relaxed after treatment. And usually treat, anywhere from 1 to 2 weeks is when you can see the effects of it with really minimal downtime.
I love that. And I love how in this photo specifically, it kind of looks like she's less angry, which is nice.
Yeah.
She doesn't look as frustrated, which is really nice. I'm sure that she probably appreciated that too. So this is a similar situation in the forehead, right?
Yeah, exactly.
It's a beautiful response. You can definitely see here that it did smooth out somewhat some of the indented lines in her forehead. But I definitely think we have some things coming up that could kind of assist in like alleviating a little bit more of that noticeable creasing in the skin.
Yes. So this is a good picture of what we call our platysmal bands, and those are the muscles in our neck when you're able to make those bands and sometimes create lines in the neck. And so we can actually place the neurotoxin or the neuromodulator all along that platysmal band on each side and just soften some of that muscle movement as well.
Definitely, it looks less tense, which is really a really nice effect too. And then tell us about this one. I think you mentioned this one a little bit earlier.
Yep. So that's a good example of a pitted or a peach pit chin. And you place the neuromodulator right in the middle of the muscles, right above that chin, and we can smooth that out too, so we don't have that dimpling look.
I love how smooth that makes her skin look. That's awesome. So we talked a little bit about wrinkles. So there's something called dermal fillers that we're going to chat about now really briefly, just to kind of discuss, maybe wrinkles is not your concern, maybe something about volume loss may be your concern. So tell us just a little bit about filler and what areas you might be able to treat with that.
Right. So a lot of times I'll get the question for someone who's never done cosmetics before, what is the difference? They hear about neuromodulators, Botox or Dysport, then they hear about fillers and they're not really sure what's going where, what they're used for. So a filler is mainly hyaluronic acid, and that is used to just replace volume, resupport, and lift up that skin, which can then help with some of that volume loss that we get with time. And some of the more common areas that we treat with the fillers are going to be cheeks, lips, nasolabial folds, and then your marionette lines, which go from the lower part of your face by the corners of your mouth.
I love that. And we have a presentation coming up on Hot Topics with Dr. Sharon Meyer, and she's going to go into a little bit more information about HA fillers and biostimulators, which I think will be really great if you want more in-depth information on fillers. And then we've obviously got the Juvederm and Restylane family and RHA. So there's obviously, just like there's Botox and Dysport, there's various lines of product that you're welcome to use. And those are something that you can chat with your provider about. And then, like you said here's just a little diagram of some of the areas that you're able to treat with injectable fillers. But that's another one of those situations where meeting with your provider and having that consultation will assist you with figuring out what areas to target and how you're able to utilize HA filler to kind of restore volume and help with that anti-aging effort. And so once we've talked about wrinkles and volume, then we can move into other things that kind of give away age, which is going to be kind of your pigment and texture concerns that you may have of the skin. So one of those being, especially with us being in the South, is sun damage. So tell us a little bit about it.
Yes. So after we have years and years of sun damage, that's why your sunscreen is so important. We'll talk about that in a little bit. But with time, all those UV rays, they cause photoaging with time. And not only does that put you at more risk for skin cancer, but also can give you these aging spots, age spots, hyperpigmentation, dark discoloration, loss of skin elasticity with time, different texture of your skin, broken blood vessels, and a term we call poikiloderma, which is just a lot of different mixture of discoloration. We might have some brown spots, some light spots, some red spots mixed in, all just from the damaging effects of the UV rays.
Definitely. And then tell us a little bit about how scarring differs from that.
Yeah, so scarring is going to be trauma to the skin. You might have had a previous bad case of acne, previous surgeries, any kind of trauma to the skin, viruses like chickenpox. Those are all things that might cause a different in texture of the skin. And we have a lot of great tools that we can use to address scarring as well.
Well, spoiler alert, here they are. So let's talk about the first one, microneedling. So what's microneedling?
So microneedling is a device that we use that we pass over the skin that basically causes tiny little penetrations and micro injuries to the skin, that then promotes our own body to come heal the little micro wounds. And during the healing process, we'll make our own growth factors and our own collagen to then overall give us a better texture and tone. And that can help with scarring and also fine lines and wrinkles.
Ah, that's amazing. I am ready for that. I feel like that's something that I could use. And then to take it one step further, kind of tell us how laser resurfacing might be different from microneedling.
Yeah, so we're going to get a little bit deeper penetration, address a little bit more, um, deeper scarring, and this is just going to be a little bit more advanced than microneedling. Laser resurfacing, we have the Fraxel and the CO2 laser. A little bit more downtime, but this will help some of the deeper scars, texture. Same thing can help skin elasticity and fine lines and wrinkles by temporarily causing a little bit of damage to the skin so that then we can rejuvenate and make healthier skin.
I love that. I love that there are so many options. And then here's another one that is really great too, is chemical peels. What can you tell us about those?
Yes, so we have lots of different peels, different ingredients, glycolic acids, alpha hydroxy acid peels. They're all can target different levels of penetration into the skin. This is going to be a little bit more of a superficial procedure where you're targeting the epidermis, the outer layer of the skin. We want to exfoliate and help with, again, some fine lines, wrinkles, texture, and some age spots this way.
Yeah, I love that, like I said, the options that there are to kind of get to the same end point, that there's a lot of different ways, especially if you're new to cosmetics. It's great that there are options that are a little less aggressive per se, or spicy that some might say. And then there's ways to kind of dive in head first, which is really exciting, but consultation is key for those. And then you hinted at this earlier and mentioned sunscreen, but tell us a little bit about how skincare is able to assist us with our concern with texture and tone.
Yes, your skincare regimen, what we do on a daily basis is very, very important. Probably the most important is we need to protect. So we need daily sunscreen. Everyone needs a daily sunscreen. Even if you're just getting in your car to go to work or run errands, we need to be blocking the harmful UV rays. So that's most important, not only for the aging skin that we're talking about that we don't like the way it looks, but to protect you from skin cancer. And then using a retinoid, that's probably the second most important. We want to exfoliate and renew. We want to increase our rate of skin's turnover, cell turnover, help with the fine lines and the wrinkles, and texture and tone with a retinoid, which is like Retin-A or tretinoin and Tazorac. And then using antioxidants, that helps as well. It helps fight the free radicals, not only from the sun, but just from environmental harmful agents like pollution and smoke. And it can also help, with time, just protect and then rejuvenate all with your skincare regimen. And that's what a consultation is really important for, because there's so many different products and things that we can link together to make it right for that individual patient. And then to take it a step further to enhance all of the cosmetic procedures that we just talked about. Those are important and can give you that result you're looking for, but also coupling it with your skincare and making sure the surface of your skin is just as healthy.
I love that. And like we said, consultation is key. We want to make sure that we're partnering the correct things to address your concerns for your specific skin type. And so with that, I want to thank you, Alicia, so much for taking the time to meet with us today and share all this amazing knowledge. If you're in the New Orleans area and Metairie, go see Alicia. She's fantastic. Or find your other Sonova dermatology provider, and we'd be happy to help you out. But thank you so much, Alicia.
Thank you.